Today, Sinn Féin are hosting a seminar entitled Diagnosing Brexit, the Impacts on Healthcare, not just in the north but right across the island of Ireland. We have 4 speakers from different sectors. It's clear that there's nothing positive in terms of healthcare to come out of Brexit. There are issues around the supply of medicines, the European health insurance card, cross-border services such as the paediatric cardiology service, the radiography in Altnagelvin and Derry, and other issues as well. And there are big issues about workforce recognition of qualifications on both sides of the border, the ability of workers to cross the border to get to their place of work. Sinn Féin believes the only way we can avoid the negative consequences is for the North to be granted special designated status within the EU. Those involved in healthcare and those who represent various sectors should be speaking out now and letting people know the consequences of what are going to happen as a result of Brexit.
During my contribution today, I was attempting to reflect what service users and carers have been telling me for some time is the impact they see out of a hard Brexit. The impact on medicines and whether medicines availability will still be capable after that date. Also on the impact of employing people to help in with the people that they care for the individuals that employ people as part of the direct payment system, and how agencies and healthcare statutory agencies will be able to get people to do domiciliary care. And I suppose beyond that we have the impact of the removal of the European health card, which will impact undoubtedly more so on people with long-term conditions and disabilities than any other section of society. It will effectively discriminate against them taking holidays outside of this island.
I think it's increasingly important that different people and civic society organisations here make their voices heard on our real fears about the negative impact of exit from the EU. The entire National Health Service since its inception has relied in large part on workers coming from other countries to deliver our health and social care system. It isn't any different in the 21st century. It's not any different here in the north, and we have relied on the European workforce and also the non-EU workers coming in here to take up vital frontline jobs because of the fear of Brexit, because of the disturbing rise of the right, because of increased racism, among other things. We're seeing people leave. Some return home, others go to other countries, particularly inside the EU, where they feel their rights will be better protected. That's shame on us, and we've got to stand up and do something about that.
This has been a fantastic event here in the Long Gallery today. There's a huge amount of consensus and a huge amount of concern around the implications and the uncertainty around Brexit. We have been pressing the Department of Health for answers in terms of medications, in terms of workforce issues, in terms of regulatory alignment. To date, we have not got any satisfactory answers or clarity on these issues. Ourselves as MLAs and the MEPs and every other Sinn Féin representative will continue to press for this clarity and will continue to work with all in society to highlight the imminent dangers around Brexit.
Sinn Féin, go on in carta agus aontas na hÉireann, equality, rights and Irish unity.